Hello, future nurses. This is Professor Flourish. Today, we're going to be talking about some of our autoimmune disorders and the connective tissue ones. So first, starting out, I just want to give a little bit of an autoimmune refresher. Remember that these are basically what happens is you have small antigens that bond with healthy tissue. Body produces antibodies that attack healthy tissue. That's what's happening with our autoimmune disorders. It can be triggered by toxins, medications, bacteria, and viruses. Unfortunately, there is no cure for autoimmune disorders. And remember, these are genetically linked. And your main goal of therapy is to control the manifestations and decrease the number and frequency of exacerbations. Occurrence of autoimmune disorders does increase with age. So the first one we're going to be talking about is our lupus erythematosus. So lupus erythematosus, or what you'll usually see it called is lupus, is an autoimmune disorder. It's an atypical immune response which results in the chronic inflammation and destruction of healthy tissue. Lupus will vary in both severity and progression, and is generally characterized by periods of this exacerbation, which are referred to as your flares and remissions. So anytime we talk about exacerbation, what we're talking about is just like this exaggerated form of the disorder. There are three types of classification of lupus, which we'll talk about in the next slide. And the thing about it is it can be difficult to diagnose because of the very vague nature of these early manifestations. So the first one you've got is discoid lupus erythematosus, or DLE. And with that lupus, it only affects the skin. You've got systematic lupus erythematosus, or SLE, which affects the connective tissue of multiple organ systems and can lead to major organ failure. And then you've got medication-induced lupus erythematosus, which can be caused by medications. So that can be things like your hydralazine. So usually what will happen with this medication-induced lupus is findings will resolve when medication is discontinued. Some of your risk factors include being female from the age of 20 to 40. Usually it will decline in females following menopause, but it does remain steady as a risk factor throughout male's life. Asian, Hispanic, or Native American descent is also a risk factor. And unfortunately, the diagnosis can be delayed in your older adults because many of the manifestations mimic other disorders or can be associated with reports common to the aging process. So things like your joint pain or limiting ADLs. So these are your expected findings. It can be things like fatigue, some general weakness, alloplasia, blurred vision, pleuritic pain, anorexia or weight loss, depression, joint pain, swelling, tenderness, and weakness. Some of the physical findings are fever, which can be a major indication of exacerbation, anemia, lymphoendopathy, pericarditis, so the presence of a cardiac friction or a pleural friction rub, Raynaud's phenomenon, which I'll talk about in the next slide, and that's that arterial vasospasm in response to cold or stress, erythematosus butterfly rash on the nose and cheek, which can be that raised, dry, scaly, and I'll talk about that in just a bit. The thing about it is few to no manifestations if lupus is in remission. With exacerbation of lupus, multiple organ systems are often affected. So that can be things like your kidney, heart, lungs, GI tract, and vasculature. Now, the skin lesion here is very important for you all to know. It's this butterfly rash. And basically what it is it literally looks like a butterfly. Like you can see it on here, where we've got it, where it's going from the cheeks across the nose. And it's important for us to know this physical assessment because when we're talking to our physicians or we're reporting what we found, it's easier for us to say, oh, they had a rash that looked like a butterfly. Since the early manifestations are pretty vague, it might help direct the provider into what direction we want to look for. So just kind of remembering that it has this little butterfly rash to it. Raynaud's phenomenon is basically what happens is you have this painful vasospasm of arteries and arterioles in the extremities, so especially in the digits. And it can cause red, white, blue skin color changes on exposure to cold or stress. So what will happen is they can have, like, I like this little picture here because it kind of shows it. Skin turns white as blood flow is restricted. Skin turns blue as blood vessels react. And then skin turns red as blood flow returns. So if they're very cold or very stressed, they'll have this Raynaud syndrome. The cause is unknown, but it does occur more in women and may be an autoimmune disorder because it's associated with things like rheumatoid arthritis and your lupus. So what they might give them is nifedipine, which is a calcium channel blocker. So if I put a medication on here, it's probably worth knowing. Nifedipine basically prevents the calcium from entering the cells and allows those blood vessels to relax, thus increasing oxygen and blood flow. So it basically keeps the calcium from entering cells, and then they get more blood flow through it. So that's why it helps them. So the reason they're receiving this calcium channel blocker is not for their blood pressure, but in hopes to help prevent that calcium from entering. Now with this, you just kind of want to also remember just your general skincare for that butterfly rash. So things like using sunscreen with SPF of 15 or higher, wearing a wide brimmed hat when outside, avoid being outside during the hours of greatest sun intensity, reapplying sunscreen throughout the day. So even if you swam, you took a shower, anything of that nature, you still want to reapply your sunscreen, and avoiding UV and prolonged sun exposure. These are some of the laboratory tests that you'll see. So a skin biopsy is used to diagnose DLE. Immunologic tests are used to diagnose SLE. You've got your bun and blood creatinine, which are increased with kidney involvement. You'll also have pancytopenia, which that basically means that you're seeing, like, let's break down this word. Pancytopenia. I know cyte means cells, penia means little, and pan means all. So this is literally telling me there's a decrease in all cell types. So that's one of the things that you'll see is that if you, what's it called? One of the lab tests you'll see is a decrease in everything. Your inflammatory tests, you'll have an ESR and C-reactive protein. So your ESR measures how quickly RBCs settle inside a test tube, which can indicate inflammation, and it is elevated. Your C-reactive protein is used to detect acute phase protein, reflecting inflammation and tissue damage, typically remains low or only slightly raised in lupus. So both those are your inflammatory. And it is important to know your different lab tests. So I gave you guys that worksheet that kind of goes through different types of labs, what they mean, and who's up, who's down. Do actually look at that because it's helpful when you're seeing these so it doesn't feel so out of place when you're looking at it. So the next thing is our medications. So the first thing they're going to do is give them NSAIDs. These NSAIDs are used to reduce inflammation and hopefully help with that arthritis pain. It's counterindicated with patients who have impaired kidney function. The other thing that you're going to see a lot with our autoimmune is corticosteroid steroids. If you're not familiar with corticosteroid steroids, my suggestion to you is go back and refresh yourself on them, because these steroids are very, very big in the autoimmune world. Basically what happens is if nothing else is working, we're going to go with our corticosteroid steroids. Now with lupus, it is basically the cornerstone for this disease process. So prednisone in particularly, they'll be on it for a long term. So it's used for immunosuppression and to reduce inflammation. Now with this, you just want to remember the different kinds of things for your corticosteroid steroids. Do not stop taking the steroids abruptly. You want to gradually taper. Older adults have increased risk for fractures if corticosteroid steroid therapy is used. And you want to know your long versus short-term effects. So long-term effects are things like the moon face, buffalo hump, weight gain. all the things that we just have way too much steroids on board. Short term are things like nervousness, crying easily, hypertension. So making sure that you know if they're on long versus short. And if this is lupus, they're going to more than likely be on a long-term regimen. Your immunosuppressants, so things like your methotrexate, your isoprene, are used to suppress the immune system. Your bivalent is a human monoclonal antibody administered with other medications for your lupus that inhibits the stimulation of B cells, reducing the autoimmune response. And then when they're taking these immunosuppressant agents, letting them know to avoid live vaccine administration for 30 days before beginning their therapy. And then you've got your anti-malarial. So hydroxychloroquine is used for the suppression of sinusitis. So basically what happens is we're trying to decrease that inflammation of those joint membranes. It can be used for the fever, fatigue, and you want to encourage them to have that frequent eye exams. So with your nursing care, you want to provide small, frequent meals if anorexia is a concern and offer between meal supplements. So giving them something like Ensure. Encourage patients to limit salt intake or fluid retention secondary to steroid therapy. Provide emotional support to the client and family. So it can be very difficult for patients who have this, along with both them and their family, because patients with autoimmune disorders, they'll have very, very good days and then they'll have very, very bad days. So on some days, it's like they want to get up, do everything they can, walk the dog, do all of that. On other days, they need a little bit more rest, and it's just kind of learning how to balance that. So with that, you want to teach your patients the risks of pregnancies with lupus and treatment medications, to take immunosuppressants and corticosteroids as prescribed. So making sure that they are tapering them down accordingly. To have a balanced diet and exercise routine. So having low impact exercise. You want to avoid, so these are the things that's a little bit more difficult, because sometimes in my opinion, it's easier to teach patients what to do instead of what to avoid. So things to avoid: stress and illness. And I don't know about you, but it's very hard to tell somebody avoid stress and just assume that they're not going to be under stress. But you have to teach them ways to basically be like, okay, if this is getting too much, maybe just go for a walk. Maybe just kind of, do one of those low impact things. And avoiding illness. So maybe it's appropriate for you to wear a mask all the time while you're out and about. You also want to teach them to avoid overheating. So with it, I would tell them, do not do a hot bath. Even though a hot bath may be relaxing, it may result in them becoming, overheated. So no hot baths, even though they might like it, because you just don't want them to overheat themselves. And I've got an article on Momentum that kind of talks about that overheating. Long periods of rest can cause joint stiffness, so you don't want them to be staying in one place for too long. And then finally, reporting any chest pain to the provider. So these are some of our complications. We've got lupus nephritis, which patients with SLE who cannot be managed with immunosuppressants and corticosteroids can experience chronic kidney disease, resulting in the possible need for a kidney transplant. Lupus nephritis is the leading cause of death related to SLE. So you want to monitor for preorbital and lower extremity swelling. We're looking for any edema, monitoring your renal status. I'm looking at creatinine bun, and teaching the patients to take medications as prescribed and to avoid stress and illness. The other complications are pericarditis and myocarditis, and that's just the inflammation of the heart, its vessels and surrounding sac that can occur secondary to SLE. You want to monitor for chest pain, fatigue, arrhythmias, as well as fever. So the next disorder we're going to talk about is our rheumatoid arthritis. So rheumatoid arthritis is a chronic progressive inflammatory disease that can affect tissues and organs, but principally attacks the joints producing an inflammatory sinusitis. So it's mostly attacking, let me see here, this area here on the picture. It involves joints bilaterally and symmetrically. So that's important to know, especially when we get into next week talking about osteoarthritis. The rheumatoid arthritis involves joints bilaterally and symmetrically and typically affects several joints at one time. Remember, this is an autoimmune disease, so it's going to affect all of them. It's not just going to affect one area, it's going to be bilateral and symmetrical. So both your hands are going to be swelling at the same time, opposed to just one hand like it is in osteoarthritis. So usually it'll affect the upper joints first, and a systematic disease can affect any connective tissue in the body. Common structures that are affected are the blood vessels, pleura surrounding the lungs, pericardium, and the eyes as well. So it is an autoimmune disease. So knowing that rheumatoid arthritis is an autoimmune disease. And this is the pathophysiology of it. It's precipitated by white blood cells attacking the synovial tissue. White blood cells cause the synovial tissues to become inflamed and thickened. The inflammation can extend to the cartilage, bone, tendons, and ligaments that surround the joint. Joint deformity and bone erosion result from these changes, decreased joint range of motion and function. And on here, you can kind of see these stages of rheumatoid arthritis. So stage 1, the body mistakenly attacks its own joint tissue. Stage 2, the body makes the antibodies and the joints start to swell up. Stage 3, the joints start becoming bent and deformed and fingers become crooked. This misshapen joints can press on the nerves and can cause nerve pain as well. And then stage 4, if not treated, the disease will progress to the last stage in which no joint remains at all and the joint is essentially fused. So that's basically what's happening. It all comes back to the synovial membrane here. That's why you'll see it bilaterally. So when you're trying to study these things, remember rheumatoid arthritis is bilateral. You'll see symmetrical joint swelling. So it's always symmetrical. One side hurts, so does the other side, because it's autoimmune, so it's attacking all of these membranes, not just one. So for disease prevention, you can use adaptive devices that prevent development of deformity of inflamed joints during ADLs. Continue using effective joints and ambulating to maintain function and range of motion. So one of the main things is that they keep on using those joints. So some of your expected findings for early manifestations of rheumatoid arthritis are things like fatigue, morning stiffness, general weakness, anorexia, and joint discomfort. They can be very vague and can also be attributed to other disorders in the older adult. Findings depend on the area affected by the disease process. So these are some more expected findings. You can have pain at rest and with movement. So once again, you're going to have both rest pain and movement pain, because think about it. This is an autoimmune disorder where we're constantly having things destroying our membranes. Morning stiffness, pleuritic pain, so pain upon inspiration, xerostoma, dry mouth, anorexia, weight loss, and fatigue. Paresthesia, a recent illness or stressor can kind of exacerbate these. Joint pain, lack of function of the joint, subcutaneous nodules, fever, muscle weakness and atrophy, reddened sclera and or abnormal shape of pupils, and lymph node enlargement. These are some of the clinical manifestations of the joint. You'll have joint swelling and deformity. So joint deformities are late manifestations of rheumatoid arthritis. Joint swelling, warmth, and erythema are very common. So you'll see a lot of swelling on it. And what you're looking for, like I've said so many times, bilateral is what you're looking for. Are both sets of my joints swollen? Are both sets of my joints warm? Finger, hands, wrists, knees, and foot joints are generally affected, and they can become deformed merely by completing ADLs. And what you can develop to is an ulnar deviation, the swan neck, like we've got here, which is common in the fingers. So it looks almost like a swan. These are some of our diagnostic labs, which once again, you can look at that paper that I gave you guys to kind of go through each of these and what they mean. Once again, we've got our inflammatory labs here, our ESR and our C-reactive protein. Some of our diagnostic procedures, you can have erythrocytesis, which is synovial fluid is pulled out by a needle. In rheumatoid arthritis, you'll see increased white blood cells and rheumatoid factor that are present in the fluid. And whenever they do that, you should monitor for bleeding or synovial fluid leaking from the needle biopsy site. So whenever they aspirate, you just want to look for that area. X-ray can you use to determine the degree of joint destruction. All right, so some of the things that we can use are things like our NSAIDs. So treatment begins with NSAIDs. You can use your COX-2 enzyme blockers, which cause less GI distress but carry a risk of cardiovascular disease. So medications such as your celecoxib are not recommended if the patient has a history of MI. Your corticosteroid steroids. So the difference between RA and your lupus is your corticosteroid steroids aren't used for long-term in your rheumatoid arthritis. They're more for exasperation episodes. So when it's really exasperated, then we're going to give them prednisone. Your capsaicin is a topical cream to act as local analgesic. So you can kind of use that to hopefully help them. And your acetocyclic acid or your aspirin is an anti-inflammatory agent that can cause ototoxicity. So knowing that it causes ototoxicity, you just want to remember that can be things like tendinitis, hearing loss, dizziness, and even ataxia, all from that ototoxicity. So more of your medications are your disease-modifying anti-rheumatic drugs. So these work in a variety of ways to slow the progression of RA and suppress the immune system's reaction to RA that causes pain and inflammation. Relief may take several weeks. So you've got your anti-malaria agent, which is that hydroxychloroquine, your antibiotics, which is your minocycline, your sulfamides, which is your sulfazoline, and then your biologic response modifiers, which is that entracipt. With your entracipt, you do want to watch for your blood levels because they can lower all your blood counts, especially the white blood cells in your platelets. You do want to watch that. This is given through an injection, and you just want to make sure you're looking at that. They also have cytotoxic medications, things like your methotrexate. And just in general, you want them to avoid crowds and that this may affect the liver, so avoid alcohol. Some of the therapeutic procedures are things like your plasmapheresis, which removes circulating antibodies from the plasma. So that decreases attacks on the patient's tissues. And this is usually reserved for severe life-threatening exasperation. They can get a total joint replacement. Surgical repair and replacement of a joint may be done. Synovial, which is the surgical removal of the synovial membrane surrounding the affected joints. So those are all various therapeutic procedures. So for our nursing care, with this, you want to assist with and encourage physical activity to maintain joint mobility within the capabilities of the patient. So you do want to be realistic with your patient. You want to teach the patient measures to maximize functional activity, minimize pain, and monitor skin closely. So you want them to use their large joints instead of smaller joints, avoid staying in the same position for long periods of time, and to have that low impact exercise. You want to provide a safe environment, so no loose rugs, and basically having them slide objects opposed to trying to lift objects. Encourage foods high in vitamins, protein, and iron, and you want them to eat those small, frequent meals. For them, you do want to use heat and cold to the affected areas as indicated. So for morning stiffness, you can have them take like a warm shower, which once again, this is different than our lupus, where we are avoiding overheating. With them, their joints are going to be very painful, so you can have them do that. Pain in hands and fingers, you can use heat treatment. Edema, using that cold treatment. Conserve energy. You want to space out activity, take rest periods, and ask for additional assistance when needed. So you just want to make sure that they're not doing everything all at once. If they're feeling a lot of pain or very fatigued, then you want them to sit down, rest for a little bit, then continue on, because you don't want them to just overwhelm themselves and make the exasperation even worse. Because remember, stress does increase this. So the next one we're going to be talking about is our Sjogren's syndrome. So this is an autoimmune condition that causes inflammation of the exocrine glands. So those are things like our salivary glands, and it results in dry eyes, burning eyes, dry mouth, joint swelling, which results in shoulder, hips, and knee, what's it called? Pain. You can treat it with over-the-counter eye drops or artificial saliva. You want them to wear goggles to protect from outdoor wind and dust. They can use a humidifier, but not to sit in front of the fan. And they can use tepid water when showering. And you want them to avoid decongestants, coffee, alcohol, nicotine, and acidic beverages. So like I said, what this basically is they've got inflammation of those exocrine glands. So it's causing them to have that burning eyes, dry mouth. So anything that you would do that would cause dry mouth or dry eyes, you avoid. Things that you can help promote it would be helpful. So for example, using humidifiers throughout your home, very, very helpful. Now, sitting in front of a fan all day, not so helpful. Other things like using that tepid water when showering, that can be very helpful. Yes. And then avoiding things like nicotine, acidic beverages, so on and so forth. So scleroderma is another autoimmune disorder. And this one is a disease affecting the connective tissues of the skin, blood vessels, and internal organs. It's often preceded by Raynaud's phenomenon. And basically what happens is the skin becomes very dry and mobile, wrinkles disappear, extremities stiffen, face becomes mask-like. And internal changes can also occur, which are a lot more dangerous. So like I said, this is this autoimmune disease of the connective tissue. So your goal is to try to prevent infections and to manage their pain, because basically everything is becoming very dry and very hard. So this is like the CREST syndrome. So I got two different things for you guys to look at here. And the symptoms of scleroderma are usually referred to as CREST. You'll have calcinosis, which is calcium deposits in the skin, Raynaud's phenomenon, which that's spasms of the blood vessels, esophageal dysfunction, so they'll have things like acid reflux, scleroderity, so thickening and tightening of the skin on the fingers and hands, telangitis, which is dilation of the capillaries causing red marks on the surface of the skin. So that's that CREST that will kind of help you see what's going on with this patient. So priority is malignant hypertension from renal crisis. So what can happen with them is these are some of your internal manifestations. They can have that abrupt hypertension along with a headache. So that's that priority, is all of a sudden they have this hypertension. Pulmonary fibrosis from scarring of lung tissue. Although not immediately life-threatening, some patients may need supplement oxygen. Heartburn, dysphagia, because that esophagus hardens. Remember, with scleroderma, it's basically just everything's hardening. So if the internal area is hardening as well, because it's a connective tissue problem, then I'm concerned about that sudden hypertension. I'm concerned about that fibrous scar tissues, and then dysphagia. So we want to watch our patients for their swallowing. This is a video that's just showing a normal versus abnormal swallowing screen. So with your patients, these are some of your nursing interventions. For pharmacology, you want to give them corticosteroids again. That decreases that inflammation. So hopefully we don't have as much inflammatory response from the connective tissue. Omeprazole decreases the stomach acid, so that can help with that CREST syndrome. You want to provide comfort for the patient. So things like giving them extra blankets or pillows, use alternative therapies such as massages, application of heat, elevation of the head, and making sure we get speech pathology consulted. Because remember, if the esophagus is hardening like that, we're going to want to check their ability to actually swallow. This is just an experience from a patient. She kind of goes through her daily routine. If you want to see it, it is on Momentum. So the next one we are going to be talking about is gout. So it's a common form of inflammatory arthritis. It's caused by hyperuricemia, so increased serum acid. So it's the byproduct of purine metabolism. And what you have is this increase of uric acid with a consistent elevation of above 6.5 is associated with gout. So any elevation of uric acid above 6.5 means that the patient probably has gout. Increased uric acid can cause urate crystals to form and are deposited in the peripheral areas of the body. So you'll see that on the toes, hands, and ears. It can also become a kidney stones. And the thing about it is they've got these little uric acid crystallized. The one good thing is they don't usually cause, or they do not cause clot development. So they mostly just kind of hang out here. They can be triggered by alcohol, trauma, medication, stress, or illness. And each attack typically lasts 3 to 10 days. So these are some of your laboratory tests. Your serum uric acid, consistent elevation above 6.5 is associated with gout. The other type of test they might do is your 24-hour urine uric acid level and synovial fluid aspiration, because they want to see if there's any uric acid crystals in the affected joints. So with your gout, this is one of those ones that you're going to want they're going to get a lot of food questions. So it's helpful to know your foods that go with this gout lifestyle modifications. So avoid purine-rich foods. So these are all the foods you avoid. So things like organ meat, so no liver, seafood, and wild game. So with that, you do not want them to be eating any chicken liver, anything like that. No scallops, no shrimp, nothing of that nature. You want to limit alcohol intake, encourage normal body weight, and elevate the foot when the patient is experiencing foot pain. So you can use things like that foot cradle to lift it up. These are some of our medications. Alpranolol is one that we use, if you guys remember that from way back in your oncology unit. It reduces the amount of uric acid in the body, can cause bone marrow depression, and you want to drink lots of fluid with this. So at least 3,000 mL of fluid daily. Other medications are your naproxen, indomethacin, your colchicine, and your pipinazine. So those are other medications that you would use. Acute attacks are usually managed with your colchicines, your NSAIDs, and your steroids. So I kind of on here have an explanation of what each of these ones do. So the last thing we're going to talk about is just our fibromyalgia. And this is just an abnormal central venous system pain transmission and processing. So just disconnect with that. It's characterized by chronic bilateral musculoskeletal pain, multiple tender points, fatigue, sleep, and cognitive disturbances. And it can be treated with your SSRIs, muscle relaxants, your opiates, NSAIDs, and gabapentin. There's a little video here that you can also watch online. As always, if you guys need anything, just let me know, and thank you.